5 wonderful benefits of turmeric for bone and joints, side effects and safety. Do you have healthy bones? In most cases, bone health only starts to become a concern when people grow older. Looking after the bones always places last in a person's priority, except for cases when a broken bone causes extreme pain that needs immediate attention and cure. Regular exercise and calcium-rich foods are the most common recommendations to ensure healthy bones. Besides diet and physical activity, recent studies confirm the positive effects of turmeric for bones and joints. This powerful spice has also shown positive results for bone healing and protection from disorders and formation of new bones. What makes up turmeric and why is turmeric good for the bones? Is turmeric good for broken bones too? Turmeric comes from the ginger family and is known as the golden spice because of its distinct orange-yellow color and various therapeutic effects. Curcumin, one of turmeric's main components, has powerful antioxidant and anti-inflammatory properties. So, is turmeric good for bones? 5 wonderful benefits of turmeric for bone and joints. Turmeric is anti-inflammatory and anti-arthritic. Turmeric helps reduce pain and stiffness due to bone illnesses. It is a natural treatment option from medicines for those who would prefer to try natural alternatives to address inflammation. Turmeric is also anti-arthritic since it controls inflammation of the joints that are affected. Turmeric is also effective when it is combined with painkillers to alleviate pain caused by arthritis. Turmeric reduces risk of osteoporosis. As you age, your bones start to weaken and lose essential minerals. Osteoporosis results to weaker bones that are more prone to breaking. This bone condition causes pain and sometimes make the person shorter. Turmeric helps prevent the loss of bone minerals and maintain bone density. Curcumin in turmeric helps influence the activity of bone-producing cells and those that absorb old ones. Turmeric helps in bone healing. Bone fractures can cause severe pain and restricted movement. Traditionally, milk with turmeric for bones is said to aid in the healing of bone fractures. Curcumin is also said to prevent the growth of osteoclasts or cells that absorb old bones, but it does not stop the formation of new bones. These cell activities are vital to the bone healing process. Turmeric can only speed up the healing process, but bone fractures should be seen and monitored by medical professionals. Turmeric is an antioxidant and fights free radicals. Turmeric's antioxidant properties help fight oxidative stress, which can cause the degeneration of joint tissues. It helps the body fight free radicals, protects it from various serious illnesses and helps reduce inflammation and pain. Turmeric relieves knee pain. Turmeric is a natural and safer alternative to painkiller drugs to confront knee and other joint pains. Athletes who suffer knee pain because of intense training take turmeric to reduce inflammation and pain. You can try incorporating turmeric into your diet or supplement regimen to see how it benefits you. Conclusion: to boost your immune system and care for your bone health, take turmeric. Most will experience the health benefits of turmeric, especially for those who are in pain caused by inflammation. You can enjoy turmeric by making milk with turmeric for bones, or using turmeric to make broth, tea, smoothies, soaps and even face masks. Turmeric supplements for the health are also available. Which one do you want to try first? Side effects and safety. When taken by mouth, turmeric is likely safe when taken by mouth short term. Turmeric products that provide up to 8 grams of curcumin daily seem to be safe when used for up to 2 months. Turmeric usually doesn't cause serious side effects. Some people can experience mild side effects such as stomach upset, nausea, dizziness, or diarrhea. These side effects are more common at higher doses. When applied to the skin. Turmeric is likely safe when applied to the skin. It is possibly safe when applied to the skin inside the mouth as a mouthwash. When applied into the rectum. Turmeric is possibly safe when it is used as an enema. Special precautions and warnings: pregnancy and breastfeeding. Turmeric is likely safe when taken by mouth in food amounts during pregnancy or breastfeeding. However, turmeric is likely unsafe when taken by mouth in medicinal amounts during pregnancy. It might promote a menstrual period or stimulate the uterus, putting the pregnancy at risk. Do not take medicinal amounts of turmeric if you are pregnant. There is not enough reliable information to know if turmeric is safe to use in medicinal amounts during breastfeeding. Stay on the safe side and avoid use. Gallbladder problems. Turmeric can make gallbladder problems worse. Do not use turmeric if you have gallstones or a bile duct obstruction. Bleeding problems. Taking turmeric might slow blood clotting. This might increase the risk of bruising and bleeding in people with bleeding disorders. Diabetes. Curcumin, a chemical in turmeric, might decrease blood sugar in people with diabetes. Use with caution in people with diabetes as it might make blood sugar too low. A stomach disorder called gastroesophageal reflux disease (GERD), turmeric can cause stomach upset in some people. It might make stomach problems such as GERD worse. Do not take turmeric if it worsens symptoms of GERD. Hormone-sensitive conditions such as breast cancer, uterine cancer, ovarian cancer, endometriosis, or uterine fibroids. Turmeric contains a chemical called curcumin, which might act like the hormone estrogen. In theory, turmeric might make hormone-sensitive conditions worse. However, some research shows that turmeric reduces the effects of estrogen in some hormone-sensitive cancer cells. Therefore, turmeric might have beneficial effects on hormone-sensitive conditions. Until more is known, use cautiously if you have a condition that might be made worse by exposure to hormones. Infertility. Turmeric might lower testosterone levels and decrease sperm movement when taken by mouth by men. This might reduce fertility. Turmeric should be used cautiously by people trying to have a baby. Iron deficiency. Taking high amounts of turmeric might prevent the absorption of iron. Turmeric should be used with caution in people with iron deficiency. Surgery. Turmeric might slow blood clotting. It might cause extra bleeding during and after surgery. Stop using turmeric at least 2 weeks before a scheduled surgery. That is the knowledge that we have learned today without ceasing to discover other knowledge to inform others.